One of the biggest problems with sleep apnea is that many people live with it for years without realizing what is happening during the night. Because the breathing interruptions occur while a person is asleep, the symptoms are often noticed by a partner or family member rather than by the person experiencing them. The most common warning sign is loud, persistent snoring. This type of snoring is usually deeper and more irregular than occasional snoring caused by a cold or temporary congestion. It may include choking sounds, gasping, or sudden pauses followed by a loud breath. These pauses in breathing are a key sign of obstructive sleep apnea. Another common symptom is waking up suddenly during the night feeling like you need to catch your breath. Some people describe it as a sensation of choking or suffocation. Morning symptoms can also provide clues. Many individuals with sleep apnea wake up with headaches. These headaches are often caused by repeated drops in oxygen levels during sleep. Low oxygen affects blood vessels in the brain and may lead to pressure sensations after waking. Dry mouth or sore throat in the morning is another common symptom. During apnea episodes, people often breathe through their mouths, which dries the airway tissues. Daytime fatigue is one of the most noticeable effects. Even if a person sleeps for 7 or 8 hours, sleep apnea prevents the body from reaching the deep restorative sleep stages necessary for full recovery. As a result, people often feel tired throughout the day. They may struggle to concentrate, experience memory difficulties, or feel unusually irritable. Excessive daytime sleepiness can become dangerous in certain situations, such as driving or operating machinery. Some people also experience mood changes, including anxiety or depression due to chronic sleep disruption. Another overlooked symptom is nighttime sweating. The repeated stress responses triggered by apnea episodes activate the nervous system and may lead to increased perspiration during sleep. High blood pressure that is difficult to control is also frequently associated with sleep apnea. Because the body experiences repeated stress responses at night, blood pressure regulation becomes disrupted. The important point is that these symptoms often develop gradually. Many people assume they are simply tired or stressed, without realizing that their breathing repeatedly stops during sleep. High blood pressure is one of the most common chronic conditions worldwide. Millions of people take medication every day to control their blood pressure and reduce the risk of heart attack, stroke, and kidney disease. Yet many patients are surprised to discover that even while taking medication regularly, their blood pressure remains high. This situation can be frustrating and confusing. People may feel that the medication is ineffective, or that their condition is worsening despite treatment. But in many cases, the problem is not the medication itself. The real issue often lies in how the medication is taken or how blood pressure is monitored. Blood pressure regulation is complex. It involves the heart, blood vessels, kidneys, nervous system, and hormonal signals. Medication works by influencing one or more of these systems. However, medications require consistent and correct use in order to work effectively. One common problem is inconsistent dosing. Some people take medication only when they feel symptoms such as headache or dizziness. But hypertension is often called the silent disease because it usually produces no symptoms. Blood pressure may remain dangerously elevated even when a person feels completely normal. For this reason, medication must be taken consistently every day, not only when symptoms appear. Another issue is misunderstanding how long medications take to work. Some drugs require several days or even weeks before their full effect becomes noticeable. Patients who stop treatment too early may believe the medication is ineffective. Timing also matters. Certain medications are more effective when taken at specific times of day because blood pressure naturally follows a daily rhythm. For example, some medications are designed to control the morning surge in blood pressure that occurs after waking. If these medications are taken at the wrong time, their protective effect may be reduced. Another factor is lifestyle. Medication cannot fully compensate for high salt intake, excessive alcohol consumption, chronic stress, or lack of physical activity. If these factors remain uncontrolled, blood pressure may stay elevated even when medication is used correctly. Understanding these interactions helps explain why treatment sometimes appears to fail. Often the solution is not stronger medication, but better understanding of how treatment works. One of the most frequent reasons blood pressure medication seems ineffective is simple human behavior. Taking medication every day for a condition that produces few symptoms can be challenging. Many people unintentionally make mistakes that reduce the effectiveness of their treatment. The first common mistake is skipping doses. Missing medication occasionally may not seem important, but blood pressure regulation depends on stable drug levels in the bloodstream. When doses are skipped, medication levels fall and blood pressure may rise again. Another common issue is stopping medication once blood pressure improves. Some patients believe that once numbers return to normal, treatment is no longer necessary. In reality, the medication is often the reason blood pressure improved in the first place. Stopping treatment may allow blood pressure to rise again, sometimes even higher than before. Self-adjusting medication doses is another mistake. Some individuals increase or decrease their dose without consulting a doctor. This may create unstable blood pressure control and increase the risk of side effects. Improper blood pressure measurement can also lead to confusion. If blood pressure is measured immediately after physical activity, stress, or caffeine intake, the numbers may appear higher than usual. This may lead patients to believe their medication is not working. Correct measurement requires sitting quietly for several minutes before checking blood pressure. Dietary habits also influence treatment effectiveness. High sodium intake can counteract the effect of many blood pressure medications. Even when medication is taken correctly, excessive salt may keep pressure elevated. Alcohol consumption and smoking also affect vascular regulation and may reduce the effectiveness of treatment. Finally, poor communication with healthcare providers can contribute to treatment difficulties. Patients sometimes hesitate to discuss side effects or concerns, which may prevent doctors from adjusting therapy appropriately. The key point is that medication is only one part of hypertension management. Understanding how to use it correctly is essential for achieving stable blood pressure control. One surprisingly common reason people believe their blood pressure medication is not working is inaccurate measurement. Blood pressure numbers can vary significantly depending on how and when they are measured. If the measurement conditions are incorrect, the result may appear higher than the true resting blood pressure. For example, measuring blood pressure immediately after climbing stairs, walking quickly, or experiencing emotional stress may produce elevated readings. Even drinking coffee shortly before measurement can temporarily raise blood pressure. In these situations, patients may believe their medication is ineffective, when in reality, the measurement simply reflects temporary physiological changes. Proper blood pressure measurement requires a calm environment. Ideally, the person should sit quietly for at least 5 minutes before measuring blood pressure. Feet should rest flat on the floor, the back should be supported, and the arm should be positioned at heart level. Talking during the measurement can also influence the reading. Even small movements or muscle tension can slightly increase blood pressure. Another factor is the type of device used. Home blood pressure monitors are widely available, but not all devices are equally accurate. Using a validated monitor and maintaining proper cuff placement are important for reliable results. Cuff size matters as well. A cuff that is too small for the arm may produce artificially high readings. Timing also influences measurements. Blood pressure naturally fluctuates throughout the day. It is often higher in the morning and lower during sleep. Because of these variations, doctors usually recommend measuring blood pressure at consistent times each day. Keeping a daily log of measurements provides more useful information than relying on occasional readings. Accurate measurement helps doctors evaluate whether medication is working and whether adjustments are needed. Blood pressure medication works by influencing physiological mechanisms that control vascular tone, fluid balance, and heart function. However, lifestyle factors can strongly affect these same systems. If unhealthy habits remain unchanged, they may reduce or even cancel the beneficial effects of medication. One of the most important factors is dietary sodium. Excess salt intake increases fluid retention in the body. This increases blood volume and places additional pressure on blood vessel walls. Even effective medications may struggle to control blood pressure if sodium intake remains high. Many people underestimate how much sodium they consume because processed foods often contain hidden salt. Another major factor is body weight. Excess weight increases the workload on the heart and promotes hormonal changes that raise blood pressure. Obesity is closely linked to insulin resistance, inflammation, and increased sympathetic nervous system activity. These changes make hypertension more difficult to control. Alcohol consumption can also interfere with blood pressure management. While small amounts may have minimal impact, Excessive alcohol intake can raise blood pressure and reduce medication effectiveness. Physical inactivity is another contributor. Regular exercise improves vascular flexibility, reduces stress hormones, and helps regulate blood pressure naturally. Without physical activity, the cardiovascular system becomes less efficient, requiring stronger medication effects to achieve the same result. Sleep quality also plays an important role. Poor sleep or sleep disorders, such as sleep apnea, may cause persistent elevation in blood pressure, especially in the morning. Chronic stress further complicates treatment. Stress activates the sympathetic nervous system and releases hormones that raise blood pressure. If stress remains constant, medication alone may not fully control the condition. This is why doctors often recommend combining medication with lifestyle adjustments. Medication works best when supported by healthy habits. Hypertension is a complex condition with many possible underlying causes. Because of this complexity, a single medication does not always control blood pressure effectively for every person. Doctors often use different classes of medications to target specific mechanisms involved in blood pressure regulation. Some medications relax blood vessels, others reduce fluid retention. Some influence hormonal systems that regulate blood pressure. If treatment targets only one pathway while other mechanisms remain active, blood pressure may remain elevated. For example, if fluid retention plays a major role in a patient's hypertension, diuretic medications may be necessary to remove excess fluid from the body. If vascular stiffness is the primary problem, medications that relax blood vessels may be more effective. Another important factor is individual variability. People respond differently to medications based on genetics, metabolism, age, and other health conditions. A medication that works well for one patient may not produce the same effect in another. This is why hypertension treatment often requires adjustment over time. Doctors may gradually modify medication type, dosage, or combinations until stable blood pressure control is achieved. Certain medical conditions may also influence treatment response. Kidney disease, endocrine disorders, and metabolic conditions can make hypertension more resistant to standard therapy. Drug interactions may also reduce medication effectiveness. Some over-the-counter medications, including certain pain relievers and decongestants, may raise blood pressure or interfere with antihypertensive drugs. The key point is that persistent high blood pressure does not necessarily mean treatment has failed. It often means that treatment needs adjustment based on individual physiology. Regular follow-up with healthcare providers allows these adjustments to be made safely and effectively. Controlling blood pressure is not only about taking a pill. Medication is an important tool, but it works best when combined with a clear understanding of how the body regulates blood pressure. The first step is consistency. Blood pressure medication should be taken exactly as prescribed at the same time each day. Stable medication levels in the bloodstream allow the cardiovascular system to maintain balance. Monitoring blood pressure regularly also helps identify patterns. Measuring blood pressure in the morning and evening provides valuable information about how well treatment is working throughout the day. Lifestyle habits play an equally important role. Reducing salt intake, maintaining a healthy body weight, staying physically active, and managing stress all support the effectiveness of medication. Sleep quality should not be overlooked. Restorative sleep allows the nervous system to reset and helps stabilize blood pressure regulation. Hydration, balanced nutrition, and avoiding excessive alcohol or stimulants further support cardiovascular stability. Another key factor is communication with healthcare providers. If medication does not appear to work, discussing concerns openly with a doctor allows adjustments to be made safely. Sometimes a small change in dosage, timing, or medication type can make a significant difference. Blood pressure control is often a long-term process that requires patience and consistency. With proper management, most people can achieve stable and healthy blood pressure levels.